At the beginning of May, the World Health Organization received an alert about an unknown illness in Mongwalu, Ituri Province in the eastern part of the Democratic Republic of the Congo. This alert would set off a chain of events across the continent and beyond. Laboratory tests identify the disease as the Bundibugyo virus, a rare strain of Ebola that has no proven vaccine or treatment and a worryingly high fatality rate. In neighboring Uganda, the health ministry also reported its first case in the capital, Kampala. It was a Congolese national who had recently crossed the border into the country. As the number of suspected cases grew, the WHO moved to declare the Ebola outbreak a public health emergency of international concern.
WHO is aware that 13 cases of Ebola have been confirmed.
The Democratic Republic of the Congo is a place of immense wealth and beauty. It is also a land living under a recurring shadow. 16 times the DRC has fought the Ebola virus. 16 times its communities have isolated their sick, buried their dead, and welcomed survivors back. And now questions abound as to why the virus has reared its head in the DRC once again. The latest Ebola outbreak actually emerged in late April when a nurse died in Bunia, Ituri Province. However, by the time tests confirmed the cause of death, dozens of suspected cases and deaths were already being investigated. The Ebola outbreak has evolved rapidly in the conflict-torn DRC. Mongwalu, the current epicenter of the outbreak, is a densely populated gold mining zone. The miners move constantly in search of opportunities, making it difficult to trace or isolate suspected cases.
It's also related to the weak healthcare systems. For instance, in case of the DRC, we know that there's quite a limited infrastructure, and then as well as the underfunded facilities that delay the detection as well the isolation of the cases. All in all, this actually allows the outbreaks to expand rapidly.
The disease has left a trail of devastation in its wake. Bunia, the capital of Ituri, sits less than 100 kilometers from the border of Uganda. Since cases of Ebola were confirmed, local cross-border trade and markets have suffered disruptions, putting livelihoods at risk.
I buy tomatoes from Uganda and sell them to Congo to survive. Even other women cross the border from Uganda to sell onions, brooms and oil to care for their children. If we don't work together, we're all dead.
Medical facilities in Bunia have been overwhelmed, forcing health authorities to establish field hospitals. But the Congo and Uganda are not facing the outbreak alone. The Africa Centers for Disease Control and Prevention and the WHO have deployed medical supplies and infection control specialists to Bunia and Kampala. WHO Director General Tedros Adhanom Ghebreyesus traveled to the DRC to assess the Ebola outbreak response.
So I came here to show support, to listen to the communities and help based on what the communities think we should help with.
The European Union also sent medical supplies to Ituri, while the United States pledged about $112 million. The UN released $3.9 million for the response in the DRC and the neighboring countries.
Continental Preparedness and Response Plan.
South African President Cyril Ramaphosa, who is also the African Union champion for pandemic prevention, preparedness and response, said African countries had pledged about 10% of the required financing. Africa CDC Director General Jean Kaseya, however, lamented that while other partners had pledged almost $500 million, the figure decreased to around $290 million after a number of donors changed their minds.
And the next day, they are calling me to say, no, it was a mistake. We didn't really want to say that, but this is exactly what we have, or what we are committing to provide. We know some big global health institutions are sitting with billions of dollars.
But this is not the only setback that health authorities are facing. Currently in the DRC, healthcare workers are grappling with misinformation and distrust from local communities, ongoing conflict, poor infrastructure, and weak healthcare systems. Protesters and angry crowds have torched multiple Ebola treatment centers and isolation tents in Ituri Province. The violence was driven by burial disputes as locals clashed with medical staff to forcibly retrieve the bodies of relatives suspected to have died from the virus. Enormous Western cuts to humanitarian aid have also affected the Ebola response. Cuts in U.S. assistance to African countries have undermined community-level disease monitoring, data gathering, and other health response mechanisms, a development that many experts say helped exacerbate the current Ebola outbreak. Yet this is only part of the controversy. A plan by the United States to set up an Ebola quarantine unit in Kenya for Americans exposed to the virus has recently come under legal challenge.
We cannot and will not allow any cases of Ebola to enter the United States. And so the State Department and other agencies represented here, the Centers for Disease Control, HHS, others, are working very, very hard to contain this crisis to the countries where it's currently located, particularly the Democratic Republic of the Congo. And so we've surged assistance to make sure that is being contained there.
Hundreds of Kenyans protested the move on the streets of Laikipia, a town in the country's central region earmarked for the base.
Oppose, because Ebola is a very contagious disease, extremely contagious. So you cannot go and import the disease here and bring it to us and tell us you're going to contain it. Totally unacceptable.
Kenya's President William Ruto defended the proposal, calling it a partnership that would help the country prepare for and strengthen its response to global health threats.
What the American government is doing is to work with us in partnership to build the capacity to make sure that if ever we needed a facility, that facility will be there to serve the people of Kenya and to serve our friends, including the Americans.
And the Africa CDC has warned that 11 other African countries are now at risk of exposure to the virus. But even in the midst of the darkest chapters of the disease, there are glimmers of hope. On 2nd June, a Chinese medical expert team arrived in the DRC for a 3-month mission to support the Central African country's response to the Ebola outbreak.
We will work together with the DRC health authorities and relevant research institutions to study the dynamics of the disease, especially its patterns of evolution, and to formulate specific plans and strategies for next step prevention and control efforts, including relevant assistance programs.
In South Africa, research institutions are actively committing to rapid vaccine research, fast-tracking the development of vaccines to target the Bundibugyo strain. While at the Bunia Medical Center, perhaps the most promising development, 4 health workers who contracted the virus recovered and left the isolation wards. Baraka Bulambula, a pediatric nurse, returned to the same hospital where he contracted the deadly virus, becoming one of the first health workers in the city to resume duties after recovery.
Some claim health workers are only looking for money, but that is not true. The disease exists. I was one of the patients in isolation. Thank God, today I have recovered and I am back home with my family.
Across the region, the public now continues to take precautions and remains on high alert. Local and international efforts and new research offer hope. However, the next few weeks will determine the shape of this Ebola outbreak, whether it will be quickly contained or if it becomes a long-term global health concern. Wilkis Anyabwa, CGTN in Nairobi.